What are the keys to having the healthiest, most vibrant, growing, and developing infant? The answer to this question all depends on who you would ask or even what you would read or search for. But why is it so complicated to know what is truly a healthy development when there are so many opinions and perspectives on it? I want to give clarity and full confidence to you, Mom. So, in this video, we'll dig into 4 main developmental tasks for infants 4 months and younger. Truly the foundation for infant health, development, and growth. Every milestone, achievement, and in constant struggle are rooted in this and holds the answer if your baby is struggling with colic, constipation, reflux, sleep, or developmental delays. This is for moms, especially new moms, whose infants may be more difficult than they expected. More colicky, gassy, not sleeping as well as they expected, or having reflux. The pediatrician is offering you a quick fix, band-aids, like medication, and saying, you'll grow out of it. And moms, you're looking for so much more and better answers. What are we going to learn today? The 4 most important tasks for infants to master before 4 months. Eat, sleep, poop, and motor movement. What that looks like when it's going well, and what it looks like when it's a sign that your baby is subluxated and needs your help. I want to tell you a story about a little one named Luca. Luca is the most smiley baby now, but you would never have known that when he first came in. His mom had a pretty stressful pregnancy towards the end with family things going on. And when he was born, he's number 3, and his mom is already really holistic and totally loves this. And so she was really confused about why her little baby was so colicky. He would just scream and cry all day. He was having trouble latching, and he just couldn't seem to get the whole thing started. He wouldn't sleep more than 1 hour at a time. And then his mom just was like, I know that there's something going on and we need to get that addressed. Luckily, we had already seen the family, so we bring in Luca to get him adjusted. And within a couple adjustments, he was already a super happy baby and their lives were a complete 180. During those first few months of life, infants undergo remarkable transformations, but in so many cases, like Luca's, when they struggle with colic, constipation, or reflux, it causes sleepless nights. You start to wonder if it's normal. Do other parents struggle this much too? And why is nothing working? While each child is unique, it has good and bad days and develops at their own pace. Understanding the typical small behaviors and milestones can give us parents the confidence we need to help and get the help for our babies and have the confidence to stay on the course. As we dive into developmental milestones to support infants' health within the first 4 months, I want to bucket them into 4 main categories: eat, sleep, poop, and movement or motor function. Mastering these makes all the difference. So let's dive in and talk through what normal looks like and how we can help when an infant is struggling with one or more of these. This is a chart that we use in the office as well, and it goes through those 4 normal things that we look for in babies under 4 months, which sets us up for phase 2 of brain development, where we go through more of that complex neurological function. So in those first 4 months, we're looking for eating or breastfeeding or bottle fed. We want to see that the latch and feeds easily and comfortably on both sides, that there's a strong suck with the latch, and that it isn't biting or taking in too much air. We also want to see that swallowing is controlled and it's easy and can speed up or slow down as it needs to. And that there's no spit up or excessive spit up or uncomfortable following a feed. That next thing we look for is sleep. So we want to see that baby can soothe and sleep well, is comfortable in multiple sleeping positions, and after a few weeks has established a cycle of sleep and waking to eat. Sometimes it takes a little while, a week or 2, to get baby on some kind of a cycle, but it should, after about that time, develop into a certain cycle that's predictable. They should be able to sleep in stretches of 2 to 3 hours at a time, maybe more. And doing some babbling and cooing. They're starting to bring objects to their mouth as they get into that 2, 3, 4 month range. And then starting to push down when their legs are placed on a firm surface. With pooping, we want to see that food is easily digested, that they're not overly gassy or grunting while they're sleeping, that they can poop regularly. While each baby is different, bowel movements should happen often and commonly multiple times a day during the first 2 to 3 months. We also want to make sure that they're not straining and struggling when they're going. Now, when we talk about motor function or those foundational movements, we want to see first that they start holding their head up and their neck steady without support. Now, this can happen within that first month. They should not be doing that right away. That's a sign of this subluxation that we're referring to. We also want to see that they start tracking objects with their eyes. They can smile at the sound of your voice, so around 2 months. Opens and shut their hands, and they start bringing their hands to their mouth. Also, we want to make sure that they're comfortable in tummy time and engaging with toys and people around 3 to 4 months. Now, in contrast to all those normal developmental things, we want to see what would it look like if baby was struggling in one or more of these areas. Some things that would be an indication of struggle is frequent stiffening, arching, getting their head back, and their neck cranking, also excessively crying. Sometimes having difficulty holding their head up in tummy time once they get to about 1 or 2 months of age, and an inability to handle tummy time comfortably for more than a minute or 2. We also see that sometimes they have trouble trying to stand up too soon and in a stiff or a tense posture. Sometimes they have persistent struggles with sleep, digestion, constipation is more common than diarrhea, and immune function, especially early on, sinus congestion and ear infections. We also see that there's excessive crying and distress with reduced eye contact, smiling interaction, babbling, and imitating sounds. When we dig down to the root causes of why your infant may be struggling with their health, the number one factor that we see over and over again that contributes to struggles with eating, sleeping, and pooping and movement is birth trauma. This affects crucial brainstem and cerebellum regions and their wildly important role to develop all of these tasks and processes. Birth is traumatic for your baby for numerous reasons, including the baby's position in utero, the duration of the birth process, or birth interventions such as C-section, vacuum, and forceps. These all cause high levels of physical tension on the delicate tissues of the brainstem and the upper neck, which house the vagus nerve and are responsible for autonomic nervous system regulation and function, motor tone and coordination, and immune and digestive function. Pretty much all simply saying, if a newborn went through stress in utero and delivery, the systems that control eating, sleeping, pooping, and moving are affected. And your infant may be having to work too hard to do these simple foundational tasks. While the impact of these various physical stressors on a developing infant's nerves and muscles in the head, neck, and upper torso are significant, as pediatric chiropractors, we are uniquely and expertly trained at Generations Chiropractic to help infants that have experienced birth trauma and may be currently struggling with eating, sleeping, pooping, or moving. If your baby is displaying signs of colic, reflux, constipation, or is having difficulty sleeping or eating, these are all indications of your infant's nervous system being affected. If you've been told that they'll grow out of it or are feeling discouraged with these symptoms, we are always here to help. Give us a call and come get checked.